The World Health Organization defines cancer as a large group of diseases that can begin in almost any part of the body or organ in which abnormal cells grow and invade and take over more organs or parts of the body. Cancer is also commonly referred to as neoplasm or malignant tumors. Another term often heard when talking about tumors is benign, which essentially means non-harmful cancer that doesn't spread across the body or other organs. Cancer is the second leading cause of death globally, and since there are so many different types of cancer affecting different organs and parts of the body, they range in severity and outcomes. People with cancer may experience many different side effects from either treatment or the cancer itself, and can also range in severity. There are two kinds of side effects: early side effects, those which are usually experienced during or shortly after treatment, and late side effects, those that take months or years to develop and can possibly become permanent. Because there are so many different types and stages of cancer and even more types of treatments and medications, side effects can vary greatly from patient to patient and even treatment to treatment. Just a few side effects that can affect your ability to participate in physical activity are listed here. Cancer-related fatigue affects up to 70% of patients and differs from regular fatigue. Patients are normally told to rest and take it easy to improve this fatigue, but it can actually lead to muscular catabolism, which leads to chronic fatigue, and 30 to 50% of cancer survivors report that fatigue lasts months or years after their treatment is over. Many cancer patients report that fatigue is the most distressing side effect of cancer and cancer treatment, in which it affects them physically, mentally, and emotionally. Cancer-related fatigue may be caused by cancer itself, cancer treatment, or by other cancer treatment side effects. This severe fatigue can interfere with patients' activities of daily living. Recommendations from doctors and specialists often leads to a cycle in which patients experience fatigue so they rest and spend more time being sedentary, which then leads to more fatigue when doing even simpler activities of daily living, such as walking from a different room. This cycle just continues and makes fatigue worse when doing simpler and simpler activities, and deters patients from wanting to complete their rehabilitation exercises and physical activity. Because cancer is highly variable, programs should be individualized to each patient as long as it's safe and enjoyable. In general, train 2 to 4 times per week, and avoid exercises that aggravate any symptoms and stop when needed. There are no specific exercises that should be avoided.
The first strength exercise we're going to demonstrate for you is lunges into a side lunge. These are good for balance when adding in the two directions, and that's important to maintain for daily living. The modification for this is just doing regular lunges at your own pace. Next, we have the bicep curl, making sure that we balance out both upper and lower body strength exercises. And for this, just make sure that you have your shoulders back and your core engaged. And for a modification, you can do it seated and you can do alternating arms if needed. Moving on to the next lower body exercise, we have the squat with a knee up. By adding in the knee up, you work on some balance and coordination as well as joint movement. And the modification for this is just to do a normal squat at your own pace. The next upper body exercise we have is push-ups. These are good at getting the body to practice moving in one motion, and a modification for this is doing it from your knees or from a wall if needed. The last lower body strength exercise we have is step-ups with a knee drive. These are good for everyday living, for completing tasks such as stairs, and the knee drive just adds a little bit extra to work on your balance. A modification for this is just doing toe taps on a lower step. Moving on to the aerobic exercises, just make sure you're monitoring yourself so that you're staying between the 12 and 14 in the RPE scale, which would indicate that you are working somewhat hard but not too hard. The first aerobic exercise we're going to be doing is jumping jacks. This is just to make sure we get the blood pumping throughout the entire body. And for modification, you can do this seated, making sure that your feet are off the ground and you're moving your arms and feet in the same motion. Next, we have sumo punches, which uses lots of muscles in the body, including the heart and the lungs, which we want to strengthen to use for activities of daily living. After sumo punches, we have high knees, just to keep the heart rate up, and a modification for this is just doing marching on the spot, again at your own pace. Next, we have speed skaters that not only works on our aerobic capacity, but also on our agility, our balance, and our coordination. A modification for this is just doing slowed down steps from side to side. Lastly, we have jumping lunges, and a modification for this one is just doing step lunges, again at your own pace. Got him! Oh.